Okay, so in this talk, we're going to go over some key terms and indicators that are important to know in order for us to talk about health more broadly. So we'll review some of these terms, some of the way that they're measured, and the ways that they can be used in conversation or in practice. So first up, some kind of foundational terms: morbidity, mortality, and disability. So morbidity is the rate of disease within a specific population. So when we talk about populations, that could be based on a region. So we could say the region of this province or within this city. But it could also be more demographic based population. So we could talk about the morbidity rate of a certain disease or condition within men over 50 in a specific area. So, for example, we could say the morbidity rate of women with osteoporosis over 50 is this much in the city of Toronto. When we talk about mortality rate, that is the rate of death within a population. So, again, identifying a specific population based on either geographical terms or demographic terms. And then we're looking at the rate of death. And that could be the rate of death associated with a disease or condition as well. So we could say the mortality rate of complications from a heart attack in men over 50 in the city of Niagara Falls is this. Finally, we have the term disability. So broadly in health, when we're talking about disability, we're talking about any kind of temporary or long-term reduction in an individual's ability to function and carry out their normal kind of activities. So not only looking at long-term disability, but also at the short-term kind of impacts or time you may take to recover from a specific experience or condition. Next, we can distinguish between prevalence, point prevalence, and incident rate. So the prevalence is the number of people affected over a specific time period. So in order to report this, we would need to report the time period that we are talking about, and then we would count the total number of people who are affected within that time period. So we might report on the number of individuals who have the flu from 2005 to 2010 in a specific region or a specific place. When we talk about point prevalence, we're talking about the number of people affected at a single point in time. So rather than that time period, we could say this is the number of people who are affected by the flu on February 1st, 2006. And then we have the incidence rate. So the incidence rate is the rate at which new diseases or conditions are occurring within a population. And this really reflects the chance of an individual who is a part of that population might have of acquiring this disease or condition. So we could say the incidence rate of the flu in students at this university is this many. And these all may look kind of similar, but they report specific things, and there are real nuances to sometimes the way you want to report a number or what is important, particularly when we talk about different types of diseases or conditions, which is what we're going to get to next. So in order to really get into some of these details, we have to distinguish between these kinds of conditions as well. So first we have communicable diseases, which are sometimes also referred to as infectious diseases. And these are diseases or conditions which are spread directly or indirectly between people. So there are a variety of different ways in which people can spread diseases, and I think we're all kind of maybe a little bit more intimately familiar with this stuff in the context of the COVID-19 pandemic. But there are several ways in which we can spread diseases, and if they are spread from person to person, then they are referred to as a communicable disease. And this is different from what we call a non-communicable disease, which is a disease or condition that isn't spread between people. So these types of conditions could be related to our environment, they could be related to our behaviors, and there's lots of kind of different ways that these can come about as well. So for example, type 2 diabetes is a condition which can be impacted or brought on based on a variety of factors. So some being genetics, some being our diet, maybe our physical activity practices, but this would be categorized as a non-communicable disease because it is not spread from person to person. And then finally, we have injuries, um, which are their own kind of category. And an injury is any kind of unplanned incident that disrupts or affects your ability to function or to live your day to day. Next, I want to switch into a few more of these reporting numbers. And these are the next few that I'm going to talk about are ones that are used kind of more extensively in global health contexts, so in larger contexts. And the first is life expectancy at birth. So, this is the average number of years that a baby can expect to live if the current kind of trends in population health and mortality continue for the rest of that newborn's life. And this is obviously an imperfect number because these trends will change throughout an individual's lifetime, but the life expectancy at birth is based on the trends or the rates of that context on the day when that child is born. Next, we can get into these a few different mortality rates. So the first being neonatal mortality rate. So this is the rate of deaths of infants under 28 days, so in the first 4 weeks of their life. And this is measured for every 1,000 live births in a given year. So neonatal mortality rate would be reported over a given year per 1,000 live births. The next is infant mortality rate, so a similar measure, except this measure is looking at the rate of deaths within the first year of life. So still measured based on 1,000 live births in a given year, but rather than the first 4 weeks, we're looking at the first 12 months. Next, we have the under 5 child mortality rate. So this, because we're getting into a longer time frame, it's no longer a specific rate that we would be looking at, but it rather reflects the probability that a newborn will die before reaching 5 years of age. So again, looking at spreading that out over time. And this one is also measured per 1,000 live births in a given year, or reported that way. And finally, we have maternal mortality ratio. And so now shifting focus from the children to the mothers. And this is the number of women who die as a result of pregnancy and childbirth complications. And because this one is a ratio, it is measured a little bit differently. So this one is measured or reported per 100,000 live births in a given year. So key distinction there, while the infant, neonatal, and child mortality rate are reported per 1,000 live births in a given year, the maternal mortality ratio is measured and reported based on 100,000 live births in a given year. So, quick second here, take a deep breath, catch your breath. I want to offer this quote because I think this is really kind of an interesting quote. The quote says, "To make people count, we first need to be able to count people." And this is why these numbers are really important, right? To really understand the nuances of some of these health issues, we need to know what they look like on the big scale and how they're experienced differently in different places. So with that, I want to shift gears a little bit more and talk about a few different measures. The first one being the health adjusted life expectancy. So we already saw the life expectancy measure, right, being the amount of time that a newborn or a baby could expect to live based on the mortality trends when they are born. But the health adjusted life expectancy takes into account the idea of how well we live. So starts to consider issues around quality of life. So, roughly, this measure summarizes the amount of time that people can expect to live in good health. And what this does is this allows us to adjust for what they call the burden of disease in a population. So, the way that illness or disease may influence a population's or individuals who are part of a population's quality of life throughout their life. So I have a chart here that just kind of illustrates some of these nuances here. And what this does is help us compare not only the life expectancy, but our health adjusted life expectancy. So you can see there at the top of the list, we have Singapore, where the life expectancy in 2016 was 82.9 years, and the health adjusted life expectancy was 76.2 years. So what that means is a general population measure of people in Singapore has that, roughly 6 years of impact on their quality of life based on illness or disability. And it gets interesting as you go down because you see how different countries may have higher life expectancies, but then lower health adjusted life expectancies. So a notable one there, a notable few that are different there. You look at the United States at the bottom, we're looking at a 10 year difference. As well, the European Union in general, when it's looped all together, it's about 10 years. So interesting to kind of see these measures and what they look like as they're played out in different countries. And next we have what is called the disability adjusted life years. So this similarly measures the losses due to illness, disease, or deaths in a population. And it helps us to kind of calculate the effect of the experience of these diseases or conditions in regards to our life expectancy. So it's a bit more of a precise way of talking about the quality of life and the impact of disease or the burden of disease on our lives. So at the kind of population level, there can be big, broad, complex ways of calculating all this data about many different diseases and conditions and what that looks like in different populations. But for our purposes, we can kind of boil it off and look at it as our disability adjusted life years, or daily, DALY, is calculated by adding the years lived with a disability, which is also reflective of the amount of effect that disability has on one's life, plus the total years of life lost. So if we were to take our full life expectancy, and then we would calculate the number of years one lives with a disability and the impact of that disability on that number of years, as well as the number of years lost, that number would reflect our disability adjusted life years. So this number would be typically relatively small in compared to the broader picture of our whole life expectancy. So let's do one example just to kind of put that into practice. So if we have an individual who is expected to live to be about 80 years old, but at 60 years of age, they're diagnosed with a condition which results in them losing 50% of their quality of life. So what that means is for 10 years, so leading up to their 70th birthday, they would lose 50% of their quality of life. And then at 70 years old, they pass away due to this condition. So that means that last 10 years are total years lost, so years of life lost. So this means our years lived with a disability would be 5 years, and our years lost is 10 years. So that means that our disability adjusted life years for that individual would be 5 plus 10, which would be 15. And this is really kind of an oversimplified example, but just so we can put it into practice and see what that looks like. So if you're interested in learning more about these different measures and what these different measures look like and how they're calculated within different regions or on the global scale, you can check out the World Health Organization website. They have some really good information on what these measures look like in different parts of the world, in different countries, and how they're calculated, as well as some kind of discussion on the strengths and weaknesses of these different approaches. So I encourage you to check that out if you want to kind of deepen your understanding of some of these different terms and measures and how they're put into practice.